Good afternoon. I'm Councillor Graham Bridgman. I'm the Deputy Leader of the Council, the Executive Portfolio Holder for Health and Wellbeing, and Chairman of this board. I'm supported by the Vice Chairman, Councillor Jay Stewart. The other members in the meeting are Councillors Lynn Doherty, Dominic Burke, Alan Macro, and Steve Masters. Before I go on to who else we have with us, I'm just going to forewarn my Vice Chairman that I had issues with video earlier on this afternoon. So if I start to have a clash again, she may be taking this meeting. So we also have with us Meriden Peachy, is the Director of Public Health for Berkshire West. We have Joe Reeves, who is the Locality Manager for the Berkshire West Clinical Commissioning Group. We have Joseph Holmes, the Council's Executive Director for Resources. We have Matt Pearce, the Council's Service Director for Communities and Wellbeing. We also have, and I'm just looking to see if he is yet in the room, or we will have, and we expect to have, Sean Murphy and Rosalind Gator, and I can see that Mary Massey has joined us, and those three are from the Council's Public Protection team. And finally, I can see Martin Dunscombe, who is the Council's Communication Manager. Gordon Oliver will be clerking this meeting, and Kevin Griffin is the Zoom host. So I'm now going to ask Gordon to run through some standard reminders about the way in which we conduct meetings via Zoom. Gordon.
So in addition to the points shown on screen, if it becomes necessary for members to telephone into the meeting, you will not be able to signal to speak. So once everyone who has raised a Zoom hand has spoken, anyone who has telephoned in will be invited to speak in order. Any voting will be done via show of physical hands, and if we need to adjourn the meeting for any reason, you will be advised of the revised time and date of this meeting. If it's a short adjournment, you'll be able to rejoin the Zoom meeting. Otherwise, a fresh appointment will be sent out.
Thank you, Gordon. Gordon, do we have any apologies for absence?
We have had apologies from Councillor Martha Vickers, and Councillor Alan Macro is present as her substitute, and from Shyrose Claridge, Joe Reeves is present as her substitute, and also from Andy Sharp. And
I think we also have, I know that Nick Carter, the Chief Executive, is on leave, so let's add his apologies, please. Okay, members, you have had the minutes of the meeting on the 12th of April. Has anyone got any amendments that they wish to propose to those minutes? No? Right, I am happy to propose them from the chair. Can I see whether there's a seconder for the minutes? Thank you, Councillor Burke, I saw you first. Members, can we, those who were at the meeting, obviously, can I see whether you agree the minutes by a show of physical hands? I think of those of us there, that's a pass. Thank you, Gordon. And Gordon, I'm happy for my electronic signature to be attached to those minutes. So, actions out of the back end of those minutes. Joe, you were going to look at the question as to whether or not vaccine statistics related to the whole of the West Berkshire population or the particular cohort that was eligible at that point in time to take up the vaccine. We were particularly talking about those 18 and above. Did you get an answer to that one?
Yes, I did. The data presented related to the entire 18+ population, not only those in the defined cohorts 1 to 9.
So that means that the numbers are not at all bad, really. If that is the entire population, not all of them will have been called forward yet. It means that take-up looks quite good, I would have thought, amongst those groups.
Yes, I would take that from the data also.
Thank you for that. And the next point was about vaccine take-up amongst European white communities at the inequalities group.
Yes, that's been raised both at the West Berkshire and the Berkshire West Vaccine Inequalities meetings. Certainly locally, I know Community United have liaised with particularly the Polish population and are going to produce a video with one of the local pastors in in Polish with subtitles to particularly promote take up during that in that group. In terms of other European white communities, further work is ongoing and further ideas are being created. So if anybody has any suggestions, I'm very happy to feed those back into those meetings.
And finally, on matters of points arising and actions to be taken out of the minutes, Matt, there was an action seeking to obtain data for other hospitals apart from, I think it was the Royal Berks, that West Berkshire residents may use.
Yeah, I don't have that specific data to hand, Chairman, but what I do know is that that data does reflect Royal Berkshire Hospital in terms of the number of admissions are equally low now, and if any, there's not any new admissions going into hospitals. So again, apologies, but I'm happy to bring that data back at the next meeting if helpful.
Okay, members, does anyone want that specifically followed up, or are you satisfied with that? I'll take it that you're satisfied unless I see a hand. I see no hands, so Matt, that satisfies us. Thank you. Right, members, we move on to declarations of interest. Does anyone have any particular interest they wish to declare at this point? I see none. That's fine. So we'll move on to the first substantive item on our agenda tonight, which is the recovery position. And that's Joseph, I think.
Okay, thank you very much, Chairman. If it's okay, I'll just take you through a short presentation as well, and then happy to pick up any questions. Okay, I'll just share my screen. Okay, can everyone see that okay? Yeah. Okay, right, I'll just quickly move on to what we've done so far. So we had a recovery strategy which was approved last summer in the middle of 2020 by the executive, and there are a variety of headings, and I'll come on to some of those later on, but some specific actions included within there to help support a variety of areas. This is purely just a highlight of some of those. There was many more in here, but just to highlight some of the programs, some of which you will have seen at this board already. But the work with the Green Common Trust on surviving to thriving projects on mental health. A lot of work on supporting the High Street to reopen at various points over the last year, and also some work over the next few weeks and months around the Welcome Back Fund, and also some local funding to help support local businesses. Picking up as well on the sort of wider economic side of things has been the distribution of business grants. So the main two, which we've just distributed and still be distributing in the coming months, are the restart grants. So the vast majority of businesses will have already received their restart grants in the local area. And on top of that, we have the additional restriction grants, which we have 6 parts to that scheme, and those are focused on businesses and supporting those businesses over the next 11 to 12 months. So our funding's in place all the way through to March 2020 for the additional restriction grant element. So that will still form part of our recovery work over the coming months. You'd have heard as well a variety of updates around our sort of lateral flow testing sites and mobile testing and the ability for the community to pick up tests as well. And then also a variety of programs to support schools. So just highlighted there, helping to them open up fully in the recent weeks, as well as holiday activities programs which have taken place in the past month as well. As I said, these are just some of the things which should be helping out on the recovery side of things. I just want to pick up now just a few slides just to highlight a piece of work completed by the British Academy and also by the Local Government Association a bit later on, and some of these will feed into our thinking around recovery. So one around loneliness and mental health, and just showing you there some proportions of people around this time last year who felt lonely by age group, and you can see, and I think one of the themes coming out through the recovery work completed so far, and that would certainly include in our strategy coming through as well, is around the inequalities piece and trying to reduce inequalities and showing that COVID has enhanced inequalities in different areas over the past year. So you can see here that there's quite a range of loneliness there, depending on age group, but specifically around younger people, picking up on that most. You can see that this was research was completed around this time last year. And then just to highlight the importance of green space as well. So what this is showing is those people who self-reported their health as very good had a strong link to the probability of green space in their town. So higher the probability of green space, the higher that your self-reported health was during. I mean, this is research which was nearly a decade old, but it just highlights that importance of the local environment to people and as part of our recovery process as well. This is a slide just looking at, on the left-hand side of things, is looking at during COVID last year, the proportion of the workforce who were working in their usual workplace rather than at home. So the higher the number on the left-hand side, with the higher, well, it's actually a percentage reduction in people actually working at their normal workplace. i.e., the higher the number, the more people who are much more likely to be working at home. And then on the bottom hand side of things is looking at GDP. And I've highlighted in red, they're circled West Berkshire. So you can see some of the, compared to some of the comparator groups there, certainly higher levels of GDP. But you can see that there's a trend there that those areas that have higher levels of GDP also have greater numbers of people working away from their normal workplace. And again, that has an implication on our recovery strategy, as well as more people in our area compared to other areas have a much more likely to have been working from home. And also the British Academy then just summarised 9 key long-term impacts as part of COVID, and you can read them there. I'm happy to share the slides as well with the chairman, with Gordon, afterwards as well. But you can hopefully you'll be able to see in a minute that a number of these form part of our recovery strategy in the future. But you can look at number 6, picked up around the mental health side of things. And also number 5, they're talking about health inequalities, but you can see in number 3 as well, that geographical inequality as well, and also some of the economic impacts that come off the back of that. The first one, again, there, I think is a really crucial one from us, and picking up on the previous slide about those people who are more likely to be work from home, probably more likely have been in their local community more over the last year, is that increased importance of local communities. And we've certainly seen that during the response phase as well, from the excellent community response that we have seen. This slide here is from the Local Government Association. Excuse me. So this is where they do a variety of polling, normally every quarter, of a random sample of people from across the country. And they ask them a range of questions, one of which is, how much do you trust your local council? And you can see there on the right-hand side of things that during the COVID pandemic, those numbers have jumped up quite significantly compared to where they were before COVID. So it's a random group of people, but those people who trust a great deal or a fair amount was hovering around kind of the mid to high 50% mark over the last 3 or 4 years, and that jumped up by nearly over 10 percentage points at the start of COVID, and even though it's come down a little bit since the middle of last year, still seems to be at a quite substantially higher level than it was before the COVID pandemic. So there's a reflection there on the role of local councils across the country. So this isn't just a West Berkshire side, this is across the country. And again, it picks up on that theme from the previous report around the importance of local communities and then the council's role as part of that as well. So picked up on some of these elements. So looking at the next elements of our recovery strategy, talk about closing any inequality gap, but also the promotion of active lifestyles, There's funding within the budget for this current year for more work around master planning and our town centres. I spoke as well around the importance of the local community, and also remembering those who we've lost and also continue to be impacted by COVID. So our proposed priorities, and this will come through in a strategy document through to the executive within the next couple of months, are highlighted here. So just to broadly summarise, and they build very much on the existing strategy that we produced last year. So the first one's around sort of health and social well-being, recognising that we are one of the healthiest places in the country, but still trying to do as much as we can to address health inequalities. Second one around the economic recovery and renewal. Third one around supporting children and young people. Fourth one is trying to accelerate the delivery of our environmental objectives. Fifth one around our local communities and engagement with our communities. Sixth on there around enhancing our efficiency and openness and how we work with our residents and our businesses. And the last one is around making sure that not only we seizing the positives, but also recognising those that we've lost and those which whose lives have been changed forever, and to help to support them, including our own staff. I'll stop sharing now, Chairman, and happy to answer any questions.
Members, Lynn, Councillor Doherty.
Thank you, Joseph. And obviously this is a strategy I know very well. I think what's reassuring for me is the recovery priorities that we identified back in June last year have remained largely unchanged. You put an interesting slide up, which was around the long-term impact of COVID. And there was, I think, all of the areas. Are you comfortable we have covered all of those areas within our strategy? I was sort of sitting reflecting on them as you put them up, but I sort of felt that I think we've got most of those in the new strategy. Are you comfortable that we've got all of those key areas covered?
Yeah, I think so. It's a fair point, because there's loads of studies out there as well where people are trying to look at a whole variety of angles. But yeah, we had a look at this study and other ones which are around there, and trying to bring those in. Now we have had sort of subsequent questions, and one came through to Councillor Stewart recently as well, around sort of specific areas. But it's always that balance with the strategy, with making sure that it's comprehensive enough that we have some sufficient actions which we'll bring through in the next couple of months to ensure that we actually deliver and enhance our services, what we're here to deliver off the back of it, without being too specific. That if things change, and there will be some impacts we still don't know yet what there will be, but hopefully they can be covered within those wider themes that we've got in place.
Well, that was going to be my follow-up question, Joseph, because obviously last summer we did a all resident survey, and we got a lot of feedback from residents about how they've been impacted, and that helped to inform our recovery strategy. And I know we've deliberately not gone back out as an all resident survey because we've been in an ever-changing situation. Do you think there'd be a value going forward of doing that all residents piece again, where we give everybody an opportunity to tell us the areas that matter most to them?
Yeah, I think it'd be useful, and I suppose it aligns to the communication engagement strategy as well, in making sure that we are taking on board what residents are saying. It's that point around when is the best time to do it, because I think if we had gone, initially we said, well, actually we go out 6 months afterwards. I think if we'd gone out 6 months afterwards, people would have been in a very different place, because at points the sort of the end of sort of the pandemic felt nearer, and then it sort of seemed to move further away from us. So I think it perhaps be best to do it once, as this sort of lockdown ends and we move through over the summer, and people are able to both, I think, reflect on what's happened over the last 12 to 18 months, and also hopefully see a bit more stability around what the future might be, and then be able to reflect back on actually looking back over the last year, 18 months, what is it that I've seen changed in my life, and how can what the council do or does help me as part of that.
Okay. Thank you, Joseph.
Members, are we letting Joseph off there? I think we are. Thank you, Joseph. So we move on to item 5 on the agenda, members. That is a vaccination programme update. Jo Reeves.
Thank you. Again, let me do the screeny sharey. So I went through this in quite a lot of detail last time, about a fortnight ago. So I was just going to go through some of the key points. So just a reminder as ever that not the entire population of West Berkshire is covered, because this data is extracted from some of the clinical systems, and not all surgeries use those systems. And the data is about a week out of date following those reports being run and the data being collated and presented in this format. But 91% of West Berkshire's population is captured in this information. So the main headline really is the change in patients who've received a second vaccination, which has increased from 6% a fortnight ago now to 14%. In terms of the overall numbers of West Berkshire residents vaccinated, there's only been a 1% increase in the last fortnight, and that's due to the nationally reported reduced supply of vaccine. So the priority has been to focus on second vaccinations and first doses for any of the high priority cohorts. But that said, on the 13th of April, the vaccination programme was opened out to the over 45s, and today it was announced it had been opened up to the over 44s. So you see a marginal increase here of 3.6% in the 40 to 49 age group that have been vaccinated since the report 2 weeks ago. But as I said, the data was captured between about the 16th and 20th or so of April, so that only reflects a few days worth of data. So next time we should be seeing something a bit more indicative of take up. This slide we went through in quite a lot of detail last time. And just to note, a couple of ethnic groups have been identified as having lower percentage take-ups compared with other ethnicities. And here it's particularly African and Chinese groups. And we've discussed in the past the concept of pop-up clinics and sort of targeted information campaigns to promote take-up where possible. And I'm sure you'll all have seen the communications kit for Ramadan that's been shared widely, and just always taking an opportunity to reiterate that being vaccinated during Ramadan does not invalidate fasting. This slide now shows the percentage that have had their second dose. So doing really well, as I would hope, on housebound patients. Housebound patients were among the first to be vaccinated. So I think this shows good progress in terms of 47% now having had their second dose. And we'll see these figures in the bottom row increase over the next couple of weeks also. Where we've got slightly lower take up among the very youngest age groups, with the at-risk groups in particular. Again, more targeted information and opportunities for those groups to come forward and get their vaccination being taken. I've seen in particular videos circulating on social media encouraging those with serious mental illness to come forwards. And then by deprivation, this slide is pretty similar to that you saw a couple of weeks ago. So not really much to report, but overall in the more deprived wards in West Berkshire, take-up is broadly in line with the whole of the council area. So continues to be a pretty positive picture on the whole.
Thank you, Jo. Certainly, apocryphally, the story locally on Facebook is people being very surprised to get, they think they're too young to get a text message from surgery saying, call for your vaccination, and they're starting to worry about scams, and everyone's going, no, it's true, it's true. So it's a really good news story, I think, on the take up and how far down the age groups we're moving. So, and obviously rolling out the second jabs, which will come a period of time behind the first chapter, so we can expect that to ramp as well. Members, any questions for Joe? This is Councillor Masters. I saw a physical hand there.
Sorry, Chairman. Thank you. Joe, any update on the pop-up clinics at the Riverside, etc.?
Yeah, I heard back from one of the community leaders of the West Berkshire Muslim Centre, who'd been investigating among the members if we held a pop-up, and his feedback was that he didn't really think it was necessary at this time, because there had been such good take-up among the community, and was keen to do a lot more kind of promotion on social media and in newsletters, etc., to keep take-up high, but didn't feel that any particular pop-up was necessary. So I think that's acceptable given that the data is where it is, and I wouldn't want to kind of perpetuate any myths that that community was not coming forward as prominently to get the vaccine, because take-up has been really good among their community.
Excellent. Thank you, Joe. Thank you, Chairman.
Thank you, members. Thank you, Joe. Right, we now move on to local contact tracing. I know we've got Sean Murphy from the Public Protection Partnership, along with a couple of his colleagues. I don't know who's speaking to this one, but fill your boots, whoever you are.
Chairman, thank you. I will speak to it to begin with, and my colleague Mary Massey, who's on the call. Mary is Senior Environmental Health Officer who manages this on a day-to-day basis, so she'll be able to assist the board with any questions. If I may share the third presentation of the night, but it's only a few slides, and I'll talk as quickly as possible.
Don't worry,
okay.
I can assure you I can see more slides coming later, so don't worry.
Okay, can you see that?
We can.
Thank you. Yeah, so just a reminder really that this is part of a wider response actually that the service is involved in. A number of these matters I've spoken to before at this board. For example, the business compliance and enforcement matter came back to the last meeting, but at various points we've spoken about COVID marshals, outbreaks and events. So local contact tracing is part of that grouping, which overall basically contributes to the local outbreak plan and the delivery of that plan in West Berkshire. So a bit of history. We started this back in November 2020 when we officially became an NHS Test and Trace Partner Authority. So that was along with the authorities across Berkshire, we were one of the early adopters of this. So we have been involved really since the very early days of it. It's a 7-day service, which basically we carry out the 7-day tracing for West Berkshire. And then we also carry out tracing for Bracknell and Wokingham on weekends and public holidays. So they're obviously part of the wider Public Protection Partnership. The rota to date has included 36 West Berkshire staff from a variety of services, primarily the Public Protection Service and Matt's Public Health team, and is also included at one point the leader on the rota who volunteered and trained early on. It's managed day to day basically by the environmental health team, and as I say, at weekends it's joined by the wider Public Protection Service. So that's staff from licensing, trading standards, and from environmental health who form up the weekend rota, along with colleagues from communities and wellbeing. The way we operate is that each shift basically has a super user. So they are the ones that access the data from the national system, draw that data down, go through the data to make sure that it's properly sanitized and in terms of and cross checks to make sure that basically we don't find ourselves ringing people that have already been rung and things like that as far as possible. That person is also responsible for monitoring the outbreak notification system that we have in place, which is different to that. So this is workplace outbreaks, so the information that comes in about workplaces, care homes, schools and other settings. And then supporting basically the super user is a number of contact tracers. Now, clearly, obviously, the number of cases has fallen significantly. But back in the kind of early part of January, when we're getting a high volume of these cases coming through, we might have as many as 3 or 4 of these people on in any particular shift. They make the calls and then they record the information currently onto a different system. So who are these people? Well, obviously they've all had their training, which is mandatory e-learning course. It's quite a comprehensive course, as a leader will verify that it covers all aspects from data protection all the way through to obviously basically call handling and the systems. So the people we've got on the rota are a mix really of people with epidemiological and clinical experience, or commissioning experience, and or a regulatory or COVID secure compliance professional background. They have a range of skills that we've identified which are really important to this role, and primarily those are around communication, interpersonal skills, and a lot of detail. Basically, there is a lot of information there basically in the tracing system, and attention to detail is really important. And they are used to working with residents, often in difficult or more complex or stressful situations. So just very quickly, some key figures of where we got to. So we started back in November. As of the 21st of April, so the end of last week, 479 cases had come through to us for local tracing. They had been referred for a variety of reasons. So some of them were noted as difficult to contact. So these included people who were inpatients, residents who were inpatients, or staff who were tested as part of a wider workplace programme, and they didn't have any individual contact details on the system, so we had to go through the workplace. Or basically residents who unfortunately been able to participate due to illness when they've been contacted by the national track and trace system, but we were able to pick them up 1 or 2 days later. And what are our results around that? Well, basically, I'm pleased. I think this is a good record. We successfully managed to contact 75% of those, so 360. And bear in mind, these were often cases that the national system had been unable to contact at all. Of those cases that we were able to contact, we carried out full tracing on 95% of them, so 341 of them, which gave us an overall full tracing picture of 71% overall of all the ones that referred to us. Those contacts then go on to receive further basically NHS self-isolation advice and regular NHS contact. And they may also become eligible for some of the financial support and non-financial practical support with self-isolation and the like. And we're able to provide that advice. So I think just moving on to, there's only 2 more slides. So what do I think, what do we feel as a service the value has been? Well, obviously one of them for residents, obviously they've been able to associate with a local area dialing code and a local number, which I think has helped us basically get hold of some of the people that we were trying to get hold of. Certainly the local knowledge about communities and the places. So when people talk about where they've been and where they work, and the localities in West Berkshire, the staff that are taking those calls are able to easily relate to that. And I think in conversations that can be very, very helpful in terms of, getting the information that we need to get and getting it recorded properly onto the system. Importantly, we've been able to signpost to other aspects of local authority support. And we've been able to, with obviously permission, share information, for example, with the community support hub, colleagues in benefits as well. It also gives us some local intelligence analysis to minimise forward spread. So obviously what we're looking to do is to identify not just contacts, but also risk settings that they may have been in. And then we're able to pick that up with colleagues, either from public health, or pick that up ourselves and look at whether anything needs to be done around further local spread of infection. We've been able to deliver the duty of care and safeguarding role to the vulnerable by identifying them and referring if necessary, and to inform preparations and planning for possible surge testing. So it's overall, I think it's been a very useful piece of work that we've done, and I do feel it's been quite successful. If I could just very quickly hand over to Mary to talk about the very last slide, because there are changes coming and it might help the board just to know what they are. So Mary, if I could just hand over to you for this. Thank you.
Thank you very much, Sean. Could I ask for a return to the last slide, please?
Has it disappeared?
It has on my screen.
Ah, okay. Let me just, sorry, I'll reshare it, Mary. Sorry. We were doing so well.
Thank you, Sean.
Okay.
Actually, it's not here either.
I don't know where it's gone then, sorry.
We do apologise for the technical glitch. I think what I was going to summarise is, yes, there are always changes and developments afoot, and be those related to the government testing policy. I think, many of us know there has been several sustained changes or unsustained, but there is a new software development in that we will be required to transition to a system which is called ITS, and that has been designed more for local authorities, and that we will be able to see all cases locally within West Berkshire, and we will be able to determine our own priorities. So rather than receive cases from national, we will almost have first pick, which is really advantageous because we can use our local analysis to know if there are situations that we should be picking up on and managing locally, because what we do notice with the central system is without the local knowledge of settings and communities, is that the forward transmission and full identification of contacts, be they within the setting or otherwise, does always materialise. So we are very much looking forward to that development, and we will discuss with Matt and others what our local priorities should be, particularly the fixed priorities. So it may be quarantining arrivals because of the variants of concern or variants under investigation, or it may be cases that meet a profile with regards profiles or demographics that might relate to vulnerability or safeguarding issues. So with that change, of course, there will be training, but we will be able to absorb that. It will be quite minimal. Beyond that, I suppose looking to the future, we're yet to see an uptick of cases with regards step 2 local easing or national easing. And obviously as of the 17th of May, if we progress to step 3, then again, we may notice an uptick in cases. At the moment, the uptick might seem related to quarantining arrivals, again, because of the government testing programme that is in place. And we also may expect an uptick in more informal settings and situations, just because of the rule of 6 and ongoing social gatherings, and be that amongst our unvaccinated populations. But those are perhaps sociologically, economically performing within the communities. Is there anything else you would like to add, Sean?
I think that's covered it for us, I think. Thank you.
Thank you. If I can take Chairman's privilege just to link the question of current position you have and the future position with new software coming on board and perhaps more involvement in certain things, how that might link into, for this is obviously for the public watching, into surge testing and variants, and how that affects your thinking, or whether it affects it at all, whether that's something you're involved in.
I'll let you pick that one up, Mary.
Thank you, Sean. So PPP have had oversight and involvement in the surge preparation exercise that was organised by Carolyn Richardson, and we have inputted that policy preparation. I think Matt would be able to provide further information on the likelihood of surge testing, because I do believe the metrics have been revised, and perhaps that is a higher escalation than previously once was. But with that, and certainly if we move to the integrated system, then we would identify that as a key priority. whereby local contact tracing would engage with those cases, because obviously what we do want to promote and support and underpin is the full observation of self-isolation, and also, you know, not entering into a workplace or another high-risk setting, and to reduce any community transmission at all, be that within the household or broader.
Thank you. Councillor Doherty.
Thank you, Mary. Thank you, Sean. And please pass our thanks to the teams that have been doing this, because I think having experienced it, you're talking to some very ill people on the end of the phone, and it is quite a challenging role to do. So I do think our thanks should be passed on to those that have been doing this. And I know they've been doing it in addition to often their day job as well. So please do pass our thanks. Mary, I just want to clarify, because you mentioned that we will have the pick going forward of who we'd choose to contact trace, and that the national system will then pick up the others. Now, as it stands at the moment, the national system passes us those they cannot trace. So will we still, once we've passed to the national system, will we still have a pass back loop from those that they can't trace? Will that then come back to us? Because I don't think you can underestimate the value of that local response, and the fact that people will pick up their telephone if they see an 01635 number on the other end. I think that was the thing that got us this sort of foot through the front door so often. So those that are hard to trace, will they still then come back to us?
Yeah, so the existing formulation for the integrated system is that all the difficult to reach cases would continue to flow to local authority, local contact tracing. So we will not lose sight of those. And we have been very successful in obviously obtaining contacts and securing isolation and so forth. So yeah, we certainly don't want to lose that aspect. And it's also often been, as I say, a high-risk setting or a workplace testing program. So again, the vulnerability and safeguarding duty of care comes in. What the integrated system will allow us to do, as I say, is to see all of West Berkshire cases. And we will speak with Matt and others as to what we wish our fixed priorities to be. But there will always be flexibility as well, because we also get analysis about common exposure locations. And that is retrospective. So that's where somebody has been when they've been exposed to infection up until 2 days of their infectious period, which might have been before symptoms or testing, whereby they will have transmitted to others. So yeah, it could be anything. It could be a postcode, it could be an age profile or demographic. It could be an obvious link to a high-risk setting, like adult social care. Yeah, does that answer? Thank you.
She's nodding, so I think it does. Councillor Macro.
Thank you. I just wondered if we can see all these cases and we can pick the ones that we want to contact and trace. Does that could they still be contacted by the national system, or would there be a kind of lock on it? Because I'm a bit worried if they're going to be contacted by different people at different times.
Yeah, I understand your comments, absolutely, because we don't wish there to be double handling. So once it's in the local contact tracing system, that case would only ever be contacted by national as a welfare check. So it's a check-in. How are you doing? Is there anything further assistance? So they wouldn't be engaging in very long, protracted dialogue of, say, anything more than 5 minutes.
Okay, thank you.
And that unfortunately is built into the national system. So we don't have the option to override that.
Right.
That appears to be the question. So I will add my thanks to both of you, Mary and Sean, for your presentation. Thank you for the information. Very useful, very helpful. And now I will move on to item 7 on the agenda. And I suspect a presentation is coming forth from Matt Pierce. Matt.
Thank you, Chairman. Yes, you guessed right. Been doing this for far too long now. So just going to give you a brief update in terms of the surveillance picture. It's not many slides, again, mainly because of the improving position, but I wanted to give you all an update in terms of where things are at. So in terms of the overall rates, again, you'll be familiar with this. We've got the local authorities on the left-hand side. West Berkshire's highlighted. We've got the testing rate is the first column. So again, we're seeing a reduction in the number of people being tested, which is largely reflected in the lower prevalence of COVID-19 in the population at this moment in time. In terms of the percentage of individuals that test positive, we are the lowest in Berkshire, so we're at 0.3% of people that go for a test actually test positive, so really low at this moment in time. And that compares favourably to the South East and English average of 0.5 and 0.8 respectively. Again, in terms of cases per 100,000 of population for all ages, again, we're the lowest in Berkshire, which is 13.9. And again, that compares favourably to the South East and English average of 17.8 and 24.4. Slough still remains one of the highest rates in the country at 59.5. There's been a slight increase in Reading, they're at 29.7. In terms of the 60 plus age group, only Bracknell Forest are slightly lower than us in terms of the rates per 100,000 60 plus, so 5, been a very slight increase, but we're seeing variations in the rates just due to the low numbers at this time. And again, that rate compares favourably to the South East and the English average of 7.4, sorry, and 9.6. So in terms of what that mean in numbers, it's around 22 individuals that are testing positive per week, and we've kind of been at that rate now for the last few weeks in terms of those numbers, anything between 20 and 30. We'll wait to see whether those restrictions have an impact. Clearly, we've just had Easter not long ago, and the schools have only just or not long returned, so we'll see whether that has an impact as well as the shops reopening. And again, this is just obviously the infographic of all those different local authorities across Berkshire. Again, all of us now lower than the national and regional average apart from Slough, so still an overall improving position. In terms of the deaths, so again, it's been good news. So since the 2nd of April, there's been no COVID deaths reported, but clearly it has been deaths prior to that. And the non-COVID-19 deaths rate is currently in line with the average weekly deaths that we would see for this time of year over a 5-year period. So since March last year, when the pandemic started, our all-cause mortality rate has been 17% higher than it would do over the 5 years, which equates to about 248 additional deaths. And then since the pandemic started, 55% of deaths occurred in hospital, 33% occurred in home, and 6% at the care home, and 6% at home. And if you think back to the beginning or the first wave of the pandemic, actually it was around 50% of deaths in that first wave were in the care homes. So there's been a bit of a flip there. And then this graph really I just thought I'd include just shows you really those proportions. So that's since October, the burgundy colour representing hospital deaths, the greeny colour representing care homes. So you can just see the proportion of deaths have been in hospital over the last few months at least, but not forgetting the issue of long COVID, which I know we discussed here at length in a few meetings previously. In terms of the hospital activity, again, the number of admissions for COVID-19 in Royal Berkshire Hospital remained low. There were no admissions with COVID-19 on the 11th of April, so a little bit dated, but I'm sure that the position has improved since as well. And then 13th of April, there were 8 patients in the Royal Berkshire Hospital for COVID-19, which one of these were on a mechanical ventilation. So in terms of the rates per age, again, I guess really what we've got is the age ranges on the left-hand side here, and then we've just got the weeks around the bottom over time. So again, the yellow represents a really low weekly rate, potentially 0 per 100,000. The green, anything between 0 to 50. And obviously, what this clearly shows is over the age of 55 or more, the rate is 0 to 200,000. So very few number of people being infected with COVID over the age of 55, and that could potentially reflect the success of the vaccination programme. But again, rates are very low, so time will tell, but that's likely to be a sign of that. And again, you can just see, there's still levels of COVID in people under the age of 55. And that's all I was going to do for my update this evening. Again, all the information can be found on the berkshirepublichealth.co.uk website. Happy to take any questions.
I see no one with a hand up. I was simply going to comment that heat map is quite an interesting one, isn't it, Matt? Because it's showing us, I think, I'd agree with you that the vaccination program is taking effect, and that because we know that COVID affects, in terms of its ultimate hospitalization, the elderly more than the young in general terms, that we can see the rates coming down more so because the elderly are not getting infected with COVID, hopefully because they've been vaccinated, and that vaccination program is having the effect we all hoped it would have.
Yeah, but I think that's the assumption. I mean, I think the evidence now is suggesting that vaccines also have an impact on transmissibility, although that hasn't been completely determined, but that's certainly what some of the research is suggesting. And like you say, if that's a cohort that were impacted most throughout this pandemic. So yeah, it's certainly good news with that respect. Obviously, a note of caution in terms of just under half the population have yet to be vaccinated. So just to add that note of caution.
Of course. So members, I see none of you itching to ask Matt a question. Excellent. So let's move on to where we are with communications, and that's Martin. Martin.
Thank you, Chairman, and good evening, everyone. So communications over the past couple of weeks since we last met have focused largely on testing, community testing as one of the key strands towards supporting the reopening of shops and hospitality. There's been further changes to the community testing offer over the past couple of weeks. The Pharmacy Collect has been launched, so kits can now be collected from local pharmacies. And we've also launched a mobile community collect service, making the lateral flow device tests available in 25 towns and villages across West Berkshire, which has been, I hear, a really a good success in the first couple of weeks. So with those two and with changes to the other sort of community testing sites, we've been working hard just to make sure that the information we have on the website and that we're pushing out into the local community is up to date, just so that residents are as clear as possible in terms of the local options available to them for community testing. So as well as updating the website, we have started running a series of newspaper ads over the next few weeks, just to encourage people to consider community testing, to let them know how they can access it. We've been working with the Penny Post as well to get some content on there, and pushing information out through our newsletter as well. So it's continued to move on. We've kept abreast of those changes. Looking outside of testing, we've had some other health topics which we've wanted to promote over the past couple of weeks. One, time to coincide with the reopening of shops and hospitality, was some messaging around the importance of wearing face masks in addition to face visors, and not as an alternative. This was from feedback we had from partners that some people were just wearing face visors when they were out in hospitality and shops. Actually, that's not as effective as wearing a face mask, and the guidance is that actually a face mask should be worn alongside it. So we've done some work just to try and promote that, and done some nice infographics to help get that message across. We're beginning to do some work on a campaign around our parks and open spaces, so that as people do increasingly go out and about and meet up with their friends and family, in accordance with all of the rules, of course, in parks and open spaces, that they do that safely, and that they look after their local environment as well. And we did a reminder last week just about the importance of following the rules when people are out and about in terms of hospitality. We had some feedback from COVID marshals who had been out and about speaking to local businesses that on occasions the residents weren't following following the guidelines that were required in terms of eating and drinking at table service only, wearing masks and what have you. So we did some further communications about that last week, just to encourage everyone to comply and reinforce the message that actually, when people donate, it causes other patrons to feel anxious, and we don't want anyone to feel anxious when they're out and about enjoying our local businesses and shops. We've continued to publish their e-bulletins, which have gone out to local residents. And we've also last week published a new e-booklet, which we pulled together looking back at our response as a community to COVID-19. That sort of tells the story really from the very beginning, when we sort of launching the Community Support Hub and we were supporting the shielding, right through to some of the activities we've heard about today around sort of community testing, test and trace, just to show the communities just how much has been achieved by communities and by partners over the past year. That's available on the website. We're sharing it through our other channels as well. It's a really good resource, I think, just summarizes just how much has been done, and I'd encourage those of you that haven't seen it yet to go and take a look and to share it with partners. In terms of social media, we've been sharing all of the above messages on social media. We've ran a Facebook Live with Lynn looking at the recovery strategy, and I know Joseph took us through some of that earlier on. So that was really good, just letting people know what the next steps are as we move out of response and increasingly towards the recovery phase, and to answer questions from local residents as well, and let them know that actually we do have sort of plans and aspirations just beyond sort of the remainder of the spring and into summer. We've been doing some work around Ramadan as well, just to make sure that Muslim communities know they can still access their vaccinations throughout Ramadan. So looking forward, continue to promote the e-booklet that I just mentioned, and we're going to be looking to get some physical copies available in libraries and other council buildings, hopefully the community testing centre as well, just so we're sharing that with residents. We're beginning to look ahead to step 3 and the further easing of restrictions. If they go ahead as planned on the 17th of May, we'll be working with our colleagues in the Public Protection Partnership and across the council for that. The government's launching a new national vaccine campaign, which we're expecting this week, which is all around encouraging younger age groups to take up the vaccine when their turn comes. There's some information to suggest that actually they're less likely to get it. So we're going to be looking to do all we can to support that national campaign and share that message locally to encourage everyone to get their vaccine when their turn comes. There's going to be further changes to community testing, which we'll continue to share. We continue to promote the Hands, Face, Space and Fresh Air campaign, which the government's running, just to make sure when people are out and about, as I said, that they are socially distancing and taking the appropriate steps to keep themselves and others safe. And of course, working in support of our partners to promote the vaccine take-up locally.
You've come to an end, have you?
Sorry, yes, I wasn't pausing for breath. That concludes it, Graham, and I'm happy to take any questions.
Thank you, Martin. Members, do you have any questions? I see no hands. I think you've covered that admirably. Well done. Thank you. Okay, members, future agenda items. I can see that Sean came up with a potential topic. It's certainly something he and I have been discussing from the licensing angle, which is events and gatherings going forward as we move out of restrictions. So I certainly think that's a good idea. Sean, we take you up on that offer, and I'll let you start preparing your slides now. Members, anyone else have anything? If not, I suggest we do what we normally do, which is feel free to email Gordon and copy me in on anything you come up with that you think would be useful for us to discuss. So that being that, let us move on to see if you have any other business. I'll come back to our next meeting in a moment. Let me just check whether you have any other business. Again, I see no hands. Members, the next meeting might be quite interesting. The next meeting is scheduled for the 10th of May, and as you will know, that is after the intended cessation of the meetings regulations. Now, the administrative court case has been heard, haven't yet had any indication as to when judgment is going to be handed down. So we don't yet know whether the rules will change from what we anticipate. But at the moment, we anticipate that after the 7th of May, we will no longer be able to have virtual meetings in their entirety. We may be able to have some form of hybrid. Discussions are underway about that. But at the moment, it looks like our meeting will be a physical face-to-face meeting in the council chamber, obviously socially distanced and with all proper precaution. But we do certainly intend to broadcast that meeting. We are looking at all the options for streaming. So at the moment, we must anticipate a physical meeting on the 10th of May, which will be streamed to YouTube so that members of the public can see what we're up to. Councillor Doherty.
Slightly worried to ask this question of the Zoom expert. Councillor Bridgman, if this is not a decision-making body, which the local outbreak engagement board isn't a decision-making place, could we still have it virtually?
I suspect you can. Well done for pointing that out, Councillor Doherty. You picked me up brilliantly there.
I'm amazed I did.
But I do wonder, members, whether or not actually we might want to, at least, because I suspect that officers will want us to test out systems. And if we can test out systems in a non-decision making body, I'm having a meeting tomorrow about, sorry to bore you, I'm having a meeting tomorrow about virtual meetings and remote meetings and hybrid meetings and everything else to do with streaming these meetings. It may be an opportunity that officers would like us to have a go in order to test out the hybrid position and the physical position and test the kit in the council chamber for streaming a meeting. So I suspect that even if not all of you are in the meeting, I suspect I will be in the chamber trying out a hybrid meeting. I may be on my own, but let's see how that goes. So yeah, that you are quite right, Councillor Doherty. You're absolutely right. We probably don't have to hold this meeting physically in person, but let's see what we come up with, and obviously we will communicate that out to all of you so we all know what we're doing on the 10th of May. So members, can I ask you if that's everything to remain in the meeting until Kevin confirms that the live stream has ceased?